Hi, my name is David, and today I will be demonstrating a sit-to-stand exercise that would be included in a pulmonary rehabilitation program for a patient with interstitial lung disease. This exercise is important because it strengthens the muscles of the legs and hips that are used every day when standing from a chair, getting out of bed, using the bathroom, climbing stairs, and completing household activities. Improving your lower body strength can reduce fatigue during daily tasks and help patients maintain independence. This is the baseline version of the sit-to-stand exercise. The patient begins seated in a sturdy chair with both feet flat on the floor, positioned shoulder-width apart. The patient then leans slightly forward, pushes through the feet, and stands up in a controlled manner before slowly returning back into the seated position. For this patient, I would initially prescribe 2 sets of 10 repetitions, and then while performing this exercise, the patient should feel the muscles of the thighs and hips working. Breathing may increase slightly, but the patient should still be able to speak comfortably and maintain oxygen saturation above the prescribed limit of 92%. Throughout the exercise, I would monitor oxygen saturation, dyspnea level, and overall symptom response. Once the patient demonstrates good tolerance, the exercise can be progressed. One progression would be performing the sit and stand while holding light dumbbells on the side. In this case, they're kind of doggy toys. Same thing applies. Lean forward, have the weight on the opposite side with your legs shoulder width apart, and sit. Another progression would be lowering the chair height slightly. So this is as low as it can get, about 90 degrees right here, which also increases the amount of force required from the leg muscles. Obviously, progress at your own, and this is the goal. This progression helps continue improving muscular strength and functional capacity. Stronger lower extremity muscles can improve walking endurance, reduce effort during daily activities, and support the patient's long-term goal of remaining independent. Even during progression, oxygen saturation, dyspnea, and recovery time would continue to be monitored closely. If symptoms increase or oxygen saturation begins to decline, the exercise can be modified. One regression would be using a higher chair. In this instance, added a buffer. Or another option would be allowing the patient to use the armrest for assistance. This right here. Same thing, just like pushing up. The exercise pace can also be slowed, and longer rest periods can be provided between repetitions or sets. These modifications reduce the physiologic demand of the activity, but still allowing the patient to participate safely and continue building muscle memory and strength. There are several signs that indicate the exercise should be modified or stopped. The patient should stop exercising if oxygen saturation falls below the prescribed limit, if severe shortness of breath develops, if dizziness occurs, or if the symptoms do not improve with rest. I would also watch for increased accessory muscle use, difficulty speaking, abnormal breathing patterns, or prolonged recovery times. These signs may indicate that the exercise intensity exceeds the patient's current tolerance level. The sit-to-stand exercise is a practical and functional activity that helps improve lower body strength, mobility, and independence. It can easily be progressed or regressed based on the patient's symptoms and physiologic response. When combined with appropriate oxygen management, symptom monitoring, and gradual progression, this exercise can help patients with interstitial lung disease improve daily function, increase confidence with activity, and safely work towards their rehabilitation goals. Thank you for watching.